Hi, Dr. Allison Feldt here with Body Motion Physical Therapy. This video is all about pregnancy prep and pelvic expert physical therapy care during pregnancy in order to help prepare for labor and delivery. So what all the research says is that you should be doing Kegels during pregnancy. That you should hold those Kegels 10 seconds and 5 seconds and 2 seconds and repeat. And it doesn't only say that, it also says that once you're 32 weeks, you can start working on what's called perineal massage to stretch the very first layer of the pelvic floor, or the very first layer of the vaginal opening. So pretend this is the vagina. I'm gonna do my vagina like that. How about that? Can you see that? That's my vagina. Now, pretend you are massaging here. That's called perineal massage. Now that can be great. The research says that perineal massage doesn't actually help prevent tearing at all. But the research does say that Kegels help during pregnancy, or help prepare for birth. I just think it's crap. What we see clinically is that people who get pelvic expert care during pregnancy can really have amazing deliveries, and the majority of those people are gonna help set themselves up for success. The reason being is the pelvic floor is 3 layers. So you have your first layer, then your second layer, and your third layer. And a lot of times patients will, or people, women, and birthing people will go through their delivery and get stuck, or their cervix won't change and the baby just isn't coming down into the pelvis. And there's a lot of moves that can be done, of course, but sometimes even when pushing, the baby is so high that people aren't opening enough and the pelvic floor isn't pushing, and people aren't taught how to push. So the most important thing that a pelvic expert physical therapist can do to help the body prepare for childbirth is to really work manually on the pelvic floor itself. Now, can you do some of this yourself? Absolutely. But you should always get the guidance of a pelvic expert physical therapist to teach you how to do this. Because there's a couple things that we don't feel internally on ourselves during pregnancy, one of those being the cervix. You also wouldn't want to do this if you had any contraindications to internal pelvic floor work, or if you were on pelvic rest, you wouldn't do this. But the magic of opening up the 3rd layer of your pelvic floor during your pregnancy it just does so many amazing things. We see reduced risks of prolapse, we see reduced C-sections, we see improved vaginal deliveries, we see extremely efficient and decreased pushing times of our moms that go through therapy. So if there's one thing I can tell you as far as preparing your body for delivery itself, and if you want to optimize yourself to be in the best position possible to have that delivery that you're looking for, you need to be working with a pelvic expert physical therapist. You really want to open up that 3rd layer. If you've ever had tight hips, low back pain, if you're having pubic bone pain, all that kind of stuff can cause a really tight pelvic floor. If you have incontinence too, that all can be attributed to tight or shortened pelvic floors. So just the muscles are contracting and they're tight, and you might think that's really good. It's always touted that if you're tight, that must feel better for your partner. But I will tell you that tight pelvic floor muscles are not optimal for birth, because a pelvic floor needs to open, right, to get a head out. And if your pelvic floor lives in this tight position, it's going to have a difficult time opening for childbirth. So the best thing to do is not to do Kegels. The best thing to do is to really work on opening up that 3rd layer of the pelvic floor. And there's not any stretch that is really good for this. This is all manual work and massage inside the pelvis that can be done by a pelvic expert physical therapist, and should be done. And this should be standard of care, because I bargain that our birth injuries would go down, because if your pelvic floor is healthy, the healthier it is going into it, the healthier it's going to be after it. I kind of attribute it to this. If you are a professional athlete and you are in super good shape and your hamstring was, you know, used to being worked out and had flexibility in the muscle, it would have a lot of blood flow in that muscle. So if you were doing sprints one day and you tore that hamstring, or something happened and you tore your hamstring, you would recover pretty fast because you're already in really good shape. That muscle's in good shape. It's used to being stretched. It's used to being worked out. And you will recover faster than someone who just has a hamstring that they don't really use. They're out of shape. They, you know, they're not using their muscles. And so the muscles kind of atrophied and really tight. They don't have the flexibility. They can't touch their toes, yada, yada, yada. That is going to be a really hard hamstring to recover. The same goes with your pelvic floor. The more in shape your pelvic floor is, the better that your postpartum experience is going to be, the better that your birth is going to be. And so I highly recommend working with a pelvic expert physical therapist. Get your pelvic floor in shape, and by all means, that absolutely does not mean Kegels. So I hope this was helpful. I hope that you can find time and an amazing provider to get you that dynamic open pelvic floor to help increase your blood flow, and really just optimize whatever you can for your birth. So hope this was helpful. Hope you have some gauge now on what the anatomy is like, and we would love to link to this video an extended version of what it looks like to prep your body for labor and delivery. So we will add that link to the end of this video. Okay, take care, guys.